So rotator cuff is 4 muscles and tendons that surround the shoulder and provide compression, stability, and strength so that you can lift your hand overhead. The vascular supply to the tendons is relatively tenuous, meaning that in a lot of patients it can become compromised even with small injuries, and over time small little micro tears can aggregate, and then even with no injury or with a small injury, a large tear can develop within the tendon, the rotator cuff. So when the rotator cuff is injured, again, it's usually micro tears accumulating to form a large tear, or maybe just bruising, or what we call tendinopathy of the rotator cuff. When the rotator cuff is intact and just bruised, we generally call this shoulder impingement, because the rotator cuff can be kind of impinged or squished between the proximal humerus, or the ball of the shoulder socket, and the bone above it, the acromion. Occasionally even the acromion will have a small spike or spur on it that will make the impingement worse. When there's an actual tear in the rotator cuff, especially if it's acute, that can be very painful and debilitating, because now the shoulder is more unstable, and when you try to lift your arm overhead, essentially the ball is sliding around as the deltoid, the large muscle on the outside, tries to overhead lift, and there's no force coupling or compression of that ball against the socket. This can lead to a significant pain, disability, weakness, and even stiffness. If you're having a rotator cuff repair, the surgery is the easy part. The recovery is the hard part. The surgery essentially is an outpatient procedure. You come into the hospital in the morning, you go to sleep, an hour later you wake up and you go home. It's about a half-day process. The painful part is after surgery. For one, rotator cuff surgery hurts. Oftentimes you'll be offered a nerve block, which may provide some pain relief for 24 to 36 hours. But as that block wears off, or if you didn't elect for the block, the pain will be really about the lateral, anterolateral aspect of the shoulder. The pain's worsened by the fact that you have to stay in a sling. So what we're able to do is we're able to kind of replant the tendon into the bone, but the sutures and the anchors that we use are only really strong enough to hold the tendon there if there's no heavy lifting or movement of the shoulder. If you start moving the shoulder too much and firing those muscles before that tendon has a chance to actually heal, you'll simply tear that back off.